Okay, so this is part 3 under the nursing care plan, part 3. So let's take a look at this, example. So we have, the heading is there, then problem identified, okay, problems identified, nursing diagnosis, objectives or goals, nursing interventions, rationales, evaluation. For example, when you say ineffective airway clearance, that is, you identified the problem. Then in your nursing diagnosis, you are going to say ineffective airway clearance related to. So you can use the words like due to. Okay? Something that is causing ineffective airway clearance. Okay? So you are going to say due to production of mucus and bronchospasms. So production of mucus and bronchospasms, these are the things that are causing ineffective airway clearance. Okay. Now we need to have evidence. Why are you saying these are the things that are causing ineffective airway clearance? The evidence is the noisy breathing. Okay, against by noise breathing. So the noise breathing, actually you can even say wheezing sound. Okay, evidenced by wheezing sound. So you need to come up with your objective, and the objective has to be time bound. Okay, your objective has to be time bound to create a patient airway within 30 minutes of nursing interventions. Okay, or rather to promote clear or rather patent airway. Okay, to promote patient patent airway within 30 minutes of nursing interventions. So 30 minutes, so it has to be time bound. There is a time frame that we have put, making sure that as we are giving our interventions, it has to be we have to work towards our goal. Okay, and our goal is to make sure that the airway is cleared. Okay, to clear a patient's air within 30 minutes. Okay. In fact, here for me, I would say to clear the patient's airway right here. To clear a patient's airway, instead of saying to create patient's airway, for me, I would say to clear patient's airway. Okay, so you have seen. Therefore, we now go to the interventions. Okay, we now go to the interventions. Now, our interventions here. Okay, our interventions here must be, our interventions here must align with the rationales. Okay, must align with the rationale. So let's say these must be together. Okay, these must marry each other. Okay, these must marry each other. Okay, let me just differentiate them. First of all, let me just make sure that we try to actually differentiate them. This one would be in this color, then this. I'll prefer this to be in this color, then I'll prefer this to be in that same color, like that. Okay, then the last one will give it a different color. So these two, see, I have put same color here because I'm trying by all means to make sure that these marry each other. Okay, I will say I will position baby C, okay, because this is just an example, baby C in a proper position, and my rationale is to promote lung expansion. I will give the prescribed oxygen therapy of about 2 liters per minute. Okay, 2 liters per minute. Why? To increase oxygen saturation in the blood. I will give prescribed bronchodilators such as hydrocortisone. Why? In order to relax the bronchial muscles. Okay? I will nebulize the BC using salbutamol as prescribed. Why? To alleviate symptoms and to improve the air. So you've seen that the interventions are marrying with the rationales, isn't it? Interventions marrying with the rationale. Now let's go to the last one but not the least, which is evaluation. Last but not the least, which is evaluation. Okay, so on the evaluation here, on the evaluation actually, so this one I'll give it a different color like this. Okay, on the evaluation we would say breathing pattern improved after 30 minutes. So you've seen here we had said within 30 minutes, and our evaluation we are going to say within 30 minutes. So after 30 minutes I'll make sure that I assess to see if at all my goal has been achieved. So breathing pattern improved after 30 minutes of nursing interventions evidenced by normal breathing pattern, or rather absence of wheezing sound or absence of noisy sound, because this is what you saw. You heard the patient, you heard a wheezing sound from the patient, or rather a noisy sound. But after 30 minutes of giving interventions, you discover that there is an absence of a wheezing sound. So meaning that your goal has been achieved, isn't it? Your goal has been achieved. So that is how we actually write the nursing care plan. So once you do this, it means that you are going to get full 10 marks, because each problem, okay, so when you write the nursing problem like this plus so this is mostly, this is 1 mark, then here 2 marks, then here 2 marks, then here mostly we give about 4 marks here, we give about 4 marks here, then here 1 mark. Okay, so if you count 10 marks, 1, here 2, which is 3, here 2, which is 5, here 4, which is 9, here 1 mark, which is 10 marks. So if you are given, if they say identify 5 problems, meaning that 10 times 5, that is 50 marks. So once you write the proper nursing diagnosis, objectives, nursing interventions, the rationales, and the evaluation, it's possible that you can get the full 50 marks. All right, thank you so much for watching. For questions in the comment section.